Hello, lady.
Hi.
I'm Ibrahim Diallo. I'm the nurse practitioner. Welcome to the clinic. But before we start, do you give me permission to record the video for my professor?
Yes.
Okay, great. So today the examination will, focus on, the thoracic examination and the lungs. Okay. Do you have any question, any concern? You want to get a break? Please let me know. Then I can give you a break. Okay.
Okay.
All right, so sit down comfortably, please. First, what we're gonna do, I'm gonna inspect your chest, and then I'm gonna, palpate, and then percuss the chest, and then also listen to your lung sound. So you might please, open up the shirt in the front, please, so I
Okay.
can inspect. Yeah, you can lay down, temporarily.
Is it like that or you need more?
A little bit more, please. You can see here. You can see here, so the camera can see you. Yes. Perfect. Thank you. So I'm going to inspect your chest first, right? Um, this is to check if you have any abnormality as far as like a barrel chest, or if you have, you know, um, any type of rash, or skin discoloration, or if I see any type of pulsation, or I'm also gonna check, your respiratory movement, if you're using your accessory muscles to breathe, or if you have any type of edema around this area. And I see that you're breathing normally, and I'm gonna check your rate. So basically your rate is normal, is 18 per minute, and you're breathing easily. You're not struggling to use your accessory muscles to breathe. And then I'm also going to check the back of it. If you can please turn around a little bit for me. So I'm checking also the posterior part, to see about the respiratory movement and the rate. And she's breathing normally. She's not using her accessory muscles, to breathe. And then I'm also gonna check, back here, to check the anterior posterior, ratio, and it is normal. She doesn't have any barrel chest or pigeon chest. Okay. So now we're gonna move to the next step, where I am going to actually, palpate your chest, to see if there is any tenderness around, your sternal borders, right? The sternum right here, and then I'm also gonna palpate for tactile fremitus. Okay. So what I'm gonna do is I'm gonna touch you from here. If you feel any pain, then you let me know. Any pain?
No.
Okay. So the next step is I'm going to check something. It's called the tactile fremitus. The tactile fremitus is I'm gonna put my the tip of my my fingers, and I'm gonna ask you to say 99 very loud. All right, and then to see if there's any consolidation. Say 99.
99.
99.
99.
99.
99.
Also, I'm gonna check in the back. 99.
99.
99.
99.
99.
99.
Great. I do not see do not feel any increase in tactile fremitus, or decrease in tactile fremitus. So the vibration is equal around all the lung fields. So now what I'm going to check is your respiratory excursion. So you can please turn this way a little bit. Can you please unbutton, this shirt for me? I apologize for that. I just have to a little bit more, please. Actually, if you don't mind, can you stand up so the professor can see clearly? So what I'm going to do is I'm going to hold, put my hands around, the lung field right here, and I'm gonna ask you, I'm gonna put a little, skin fold right here. I'm gonna ask you to take a deep breath. Breathe. Breathe out. One more time. Breathe. Great. Please turn around. Okay, I'm gonna have, for privacy here, I won't be able to take out her shirt, but as you can see the movement here, I'm gonna put a skin fold. Take a deep breath. Breathe. Take a deep breath. As you can see here with respiratory excursion, the expansion is symmetrical, and it's about 3 to 5 centimeters, so that is actually great. You have a seat, please. So the next thing is we are going to now we are going to percuss around your lung field. So I might have to please ask you to move your head here a little bit, and then over here. So the percussions, what we're gonna start, if you don't mind, can you turn around this way? So we're gonna start from the upper part of the lungs right here, and then we're gonna go all the way down, okay, to percuss all the lung field. So primarily I'm gonna use this technique. I'm gonna put my finger, my non-dominant finger right here in the middle one, and I'm gonna strike it with the middle finger of my dominant hand, and using the wrist motion, okay? So I'm gonna have to remove your breast a little bit. Alright, so we percuss the lung field, we percuss the the aortic area, the aortic area, the pulmonic area. Then we also check the the ears point. A little bit down here we check the tricuspid valve, and then the mitral valve over here, and then and the other side, the enterolateral part of the lungs. Okay, so, and please turn around. I'm gonna do the same thing from the back. Turn around please a little bit more, all the way around. So I'm gonna remove your hair a little bit here. I'm gonna do the same thing. I'm gonna percuss side to side, okay? So it'll be so, as you can hear, the sound is resonant, okay? Alright, so basically I percuss the lung field. The sound is resonant all over. There's no sound of dullness, okay? So that's actually pretty good on the percussion part. And then now we're going to, please turn around. Actually, yeah, you can stay there. I'm gonna listen to your lung sounds, right? You might please have to bring this down a little bit for me, just so my professor can see the back a little bit more. There you go. So I'm gonna listen to the okay, I'm listening to the lung sounds. Well, technically I'm supposed to remove completely the clothes, the clothing down here, but for privacy reason I won't be able to do that at the moment for the respect of the patient's privacy. Here, here, light ready. Okay, then I'm gonna use the bell of the stethoscope. Sorry again, miss. Take a deep breath. Breathe out. Every time I put the stethoscope on one spot, breathe in and breathe out, okay?
Okay.
Great. 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 Sorry. The lateral part right here. One more time. Great. All right, now please turn around. Thank you very much. So I'm going to listen to the anterior part, of the lung sounds. So I'm going to use the diaphragm, of the stethoscope, right? Take a deep breath. 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 I'm sorry. I'm going to have to lift your breath a little bit here, okay? Take a deep breath. Deep breath. Take a deep breath. Take a deep breath. Deep breath. The lung sounds clear, but I'm gonna switch. I'm gonna use the bell of the stethoscope, and we're gonna repeat the same motion. Okay? I'm sorry for making you breathe so many times. Please, every time I put the stethoscope on you, breathe in and out normally. Okay? Go ahead. All right, just to just for information purposes, over here I'm listening to the aortic part, and then over here I'm listening to the pulmonic valve, and then over here this is the Erb's point. This is the this is like one. Take a deep breath, please. Great. So basically, when we listen to the Erb's point here, we can determine if there's a split S1 and S2. But for her, that means like if the tricuspid valve and the mitral valve are closing at a different pace, then you can hear the split S1 and S2. But for her case, everything is normal. S1 and S2 are audible clearly, and there's no split S1 and S2. Keep on breathing. I'm gonna lift your breast over here. Deep breath. Over here. Over here. Sorry. Over here. Great. So basically we did listen to the lung sounds, in the back, and we did, the diaphragm and also the bell of the stethoscope, and anteriorly we did the same thing. So now the next step is we're gonna check Egophony. What does that mean is I'm gonna ask you to repeat the word 99 while I'm listening to your lung sounds, okay? Then to see if the purpose of doing the Egophony test is to see if there's any lung consolidation, okay? I'm gonna use the diaphragm. Say 99.
99.
99.
99.
99.
99.
99,
99,
99,
99,
99,
99,
sorry, 99,
99,
99,
99,
99,
99,
99.
99.
So the same thing, we listen to all the lung fields, including the aortic, the pulmonic, the Eaves point, right? The tricuspid, the mitral, and then the lateral part, left and right. So there's no lung consolidation. The lung sounds clear. Now, so we did listen to the anterior and the posterior part, and then I think we are pretty much, let me just think for a minute if I forgot anything before we close the session. Yeah, I think we we done for the thoracic and the lungs part of the examination, and then we're gonna move to the next level, which is the cardiovascular. You can stop.